cases of respiratory illnesses are spiking all over the region, with the Southeast being hit particularly hard. Experts at the Louisiana Department of Health say regions 3 and 4 have the highest number of flu cases. Though the number isn't as troubling as in previous years, healthcare providers are urging the public to take precautions as we head further and further into the holiday season. Viral respiratory illnesses are making their rounds across the U.S. The CDC recorded a 6.2% increase in the nation's influenza positivity rate the first week of December, which is up at least 3% from October. Experts say it's the H1N1 virus that's responsible for most of the spread.
A new warning is out from the CDC about a rise in respiratory illnesses.
The agency is reporting RSV cases are likely peaking, flu cases are rising, and COVID-19 is still the biggest concern here.
11 states plus New York and Puerto Rico are experiencing high or very high levels of respiratory illness activity.
The cases seem to be rising the most in the West Coast, Mountain Region, and the Southeast, with little sign of slowing. Have you been seeing that uptick at Baton Rouge General?
There's been a significant increase in the emergency room and our urgent cares here in the clinic. We've definitely seen an increase in the number of flu cases that are coming in.
Dr. Jacob Wood is a family physician at Baton Rouge General Hospital. He says the emergency room is filling with patients experiencing flu-like symptoms. These symptoms, are they normal flu-like symptoms or are they more severe?
No, we've been seeing typical flu symptoms, body aches, cough, headache, moderate fever, general kind of weakness, malaise, that kind of stuff. It's been pretty typical.
What about hospitalizations?
Not a lot. We do have a couple of people in the hospital at Baton Rouge General right now with the flu, but it's not like it's overwhelming the hospital.
Louisiana's caseload has been sporadically climbing since the fall. Although influenza incidences typically increase around the middle of winter, physicians like Wood found themselves treating patients as early as October.
There was just a little sprinkling of flu coming through kind of back in September, October. We were seeing kind of sporadic cases. And, we don't really consider it a flu season when it's sporadic like that. It's more that kind of thing can happen through the year, really. But the real kind of flu season seems to have started up closer to Thanksgiving.
In addition to the flu, Wood is also seeing an increase in COVID cases. The strain's strength isn't as strong as previous variants during the pandemic, but he says it's still something to be noted. When it comes to COVID and the flu, are cases pretty even, or is the flu outpacing COVID?
I think they're pretty even, at least from what I'm seeing, they're pretty even. I think we're seeing the same thing on the statewide data, but they seem to be pretty even. And we test all of our patients that come in because the symptoms are so similar. We test for both. I would say they're about equal. And I would also say they're fairly equal in severity right now.
Wood's experience is typical of the rest of the state. The Louisiana Department of Health has been monitoring positivity rates since the initial spike in early fall. As of now, regions 3 and 4 near West Louisiana are experiencing the brunt of the spread, with portions of North and East Louisiana following suit. As more holiday festivities approach, Wood cautions that cases may rise again.
If you think that you have flu symptoms, get seen early. The treatments for the flu, especially Xofluza, is very effective, but only if you get treated in the first couple of days that you have it. So if you wait until you've been sick for 3 or 4 days, you've kind of missed the opportunity to get treated. So as soon as you start to have body aches, fever, cough, those kind of typical flu symptoms, go ahead and get seen.
So bottom line, if you or a loved one come down with a fever or flu-like symptoms, take precaution. Always cover your mouth, wash your hands, and stay home if you can.